Alright, next we're going to continue our discussion of the reproductive system, starting with the female reproductive system. So looking at the female, the job of the female reproductive is to produce an egg that will be fertilized by the sperm of the male, and then that fertilized egg that occurs, where fertilization occurs, is in the fallopian tube or the uterine tube, and then that fertilized egg travels down and implants in the uterus, and then the next job of the female reproductive system is to grow and nourish the fetus in the uterus and prepare for labor and delivery of the fetus out the vaginal canal. So the reproductive tract of the female is different from that of the male in that the reproductive tract is only for reproduction, only for the developing fetus and egg, where the urethra is only for urine flow. And we saw in the male that the urethra and the reproductive tract for the male were the same. Sperm traveled through the urethra. But that's not the case of the female. There are two separate passageways into the pelvic region. So the urethra is only for urine, and the vagina is only for reproductive processes. So looking at the ovaries then, the ovaries have about 2 million eggs at birth of the female. So during fetal development of the female fetus, there are 7 million eggs produced during that process, but by the time that fetus matures and is born, there's only about 2 million eggs. Then those eggs break down and reduce in their number until by the age of puberty, at the age anywhere from 12 to 15 years old, that female will have about 250,000 eggs remaining. And then each month an egg is developed and ovulated from that egg, which can be then fertilized. And we can see that here. The secondary oocyte has been ovulated from this ovary and will be available for fertilization. And there's only about 500 secondary oocytes that are available for fertilization, which are ovulated. Here also in the ovary we see a special structure which is called the corpus luteum, that after an egg is ovulated, the cells that surround and nourish that egg while it's developing become a special structure called the corpus luteum. And if pregnancy takes place, that corpus luteum will start to secrete hormones, progesterone and estrogen and some others, that will continue to nourish the reproductive tract to promote pregnancy and development of the fetus. But you'll get more into that if you take advanced A&P, where you talk a lot about fetal development and maturation. So the uterine tube is where after ovulation, where the egg is fertilized by the sperm. So we call it the uterine tube or the fallopian tube. And it has a widened end with these finger-like structures called fimbriae that waft the egg that's released from the ovary into the uterine tube. And this egg will remain in the uterine tube, and then after ovulation, and the sperm travel up the vagina, through the cervix, through the uterus, into the uterine tube, and fertilize the sperm in that area. And then together that egg with the nucleus of the sperm inside of it eventually will form a zygote that will develop as it changes its name into several different structures, but we won't go into that detail here. But eventually that fertilized egg will implant in the uterus, and that will develop into a fetus. So the uterine tube is what is cut, and when a woman has what they say her tubes tied, is they will cut this tube here, just like we saw in the male with the ductus deferens. They'll cut and clip and cauterize the ends of that tube so that it does not transport an egg and make it available for fertilization. So that is a good method of sterilization to prevent future pregnancies. And the uterus is a muscular organ. We saw in lab that it has 3 layers. It has the perimetrium on the outside, the myometrium on the inside, and the endometrium. The myometrium is the middle muscular layer that helps propel the baby down during labor and delivery, and it also contributes to menstrual cramps during the menstrual period. And then the endometrium, which is the lining of the uterus, which is shed every month during the menstrual period. So the role of the uterus during pregnancy is to nourish the egg and promote an environment for the developing fetus to attach and receive the nutrients and the hormones necessary to support that pregnancy. The opening of the uterus into the vaginal canal is called the cervix. So it kind of has a rounded end here, looks like a smile here. That's the cervix, and the region here is the cervical canal. And this is what opens up during pregnancy to allow the head of the fetus out to be born. When people say that they are dilated, they're referring to this opening here of the cervix. And it requires 10 centimeters of dilation to be considered ready for delivery of the newborn. So that's an important measurement that OB doctors or midwives are taking, is making sure that that cervical opening is large enough to not damage the cervix when the baby descends through the birth canal. So at puberty, just like in the male, the hypothalamus secretes a hormone called gonadotropin-releasing hormone, which acts on the pituitary gland, and the hormones of the pituitary gland act on the ovaries to increase their production of progesterone and estrogen. Estrogen is important for secondary sex characteristics of the female. So when we think of estrogen, we're looking at the female characteristics such as breast development and fat deposition around the hips and the thighs. That's characteristic of females, and that's due to the effects of estrogen. Estrogen also acts on bones and causes them to grow, so we see a growth spurt in females when they have increased estrogen production during puberty. And it also helps to lower cholesterol levels in females, keeping them, healthy in terms of having high HDL levels to prevent too high of cholesterol, because HDL is the healthy cholesterol that we want to have in a high level, and LDL is the bad cholesterol, which we want to keep low. So women after menopause do not secrete estrogen. Their ovaries are no longer functional, so they don't secrete estrogen. Therefore, their cholesterol levels might increase, and they also might develop osteoporosis because of the impact of the lack of estrogen on bone. And as a result, calcium supplements are important, as well as managing fat intake so cholesterol levels don't become high, which would increase the risk for heart attack and stroke with blood clots. So the menstrual cycle is indicative of a female entering or beginning puberty, is when she starts to menstruate. So that's when we say a female has hit puberty, is when the red bleeding occurs, and that occurs typically every 28 days. And there's several phases of the menstrual cycle. We'll talk about that. In some women who have low fat deposits, they end up with a stoppage of their menstrual cycle, and that can be due to excessive training. Marathon runners, high school athletes that are long distance runners can sometimes lose so much fat that they don't have enough estrogen to support a menstrual cycle, because estrogen is necessary for menstruation. And we also find with the increase in high-fat diets that girls are having their menstrual cycles at a younger age because they have more fat deposits on their body because of a sedentary lifestyle and a higher fat diet. So estrogen is a source, fat is a source of estrogen. So people that have more fat on their body have higher estrogen levels, and as a result, that can actually promote infertility, as well as promote certain cancers, particularly breast cancer. So it's important that women maintain a healthy weight for those reasons, because of increased estrogen levels are not healthy in terms of some of the risk factors that increase with increased estrogen levels. Menopause is when the menstrual cycle stops. That can happen anywhere from 46 to 55 years old. Average age is about 50 years old, and that's when the ovaries are no longer functional, they no longer secrete their hormones, and they no longer produce viable eggs. So here's an example of the menstrual cycle. Here we can see day 1 is marked by the beginning of menstrual flow. So the uterine lining, the endometrium, is being shed on day 1. So when red blood appears, that's considered day 1 of the menstrual cycle. And that bleeding can occur for about 5 days. Then after that, hormone levels start to increase and the uterine lining starts to rebuild again. And that uterine lining rebuilds until about day 14. And at day 14, if we look at what's happening in the ovaries at the same time, because each of these graphs overlap, at day 14, the ovary releases an egg as a result of a hormone surge that occurs from the pituitary gland, which is called LH hormone, luteinizing hormone. That surge in hormone acts on the ovary to result in ovulation. And as a result of that ovulation, we continue to see a rise in the uterine lining with the hope that that egg will be fertilized and this uterus will have a nourished, thickened lining to support implantation of that fertilized egg for pregnancy to continue. So we see an increase in progesterone at the same time to support that placenta, or I'm sorry, not placenta, to support that uterus. But then, if we don't have pregnancy taking place, what happens is the special structures that develop after ovulation to support pregnancy and to keep the uterus increasing in its thickness, it's called the corpus luteum, that will start to break down. And the hormones that would normally support a pregnancy from the corpus luteum are no longer present, and then we see a big drop in hormone levels, and that drop in hormone levels will again begin the next menstrual phase where the uterine lining starts to break down again, and at 28 days we're at the end of the menstrual cycle, and we'll see red bleeding again the next day, beginning day 1. So 2 important dates to remember for every female with their menstrual cycle is day 1 of the menstrual period. So when did red bleeding occur? What was that date? And they should write that down in a calendar, because roughly 14 days after that menstrual bleeding occurred is when they're going to ovulate or produce an egg. So this means a woman is very fertile during this time when her ovary has released an egg and it's available for fertilization from sperm from the male. So it's important that when a woman goes to the doctors usually ask, or the nurse will ask, when was the date of the last menstrual period. And they should have an awareness of that, because certain procedures are best done during certain periods of the menstrual cycle, and it's important to know that. And also for planning pregnancy or avoiding pregnancy, it's good to know when the most fertile days are of the month compared to less fertile days. Of course, if someone is taking birth control or contraception, then that becomes less of an issue, because the menstrual cycle is very regulated, because the hormone, the artificial hormone in birth control will regulate a menstrual period. And some women are on oral contraceptives for the purpose of regulating the menstrual period. So the sex act with females is very similar to that of the males. It involves the parasympathetic and the sympathetic nervous systems. And when a woman is aroused, we see blood engorgement in the clitoris, which contains corpus cavernosum, just like the male penis does. So it responds in the same way. The nipples also become erect, and a mucus-like fluid is produced inside the vaginal canal, which will lubricate the vaginal canal, which makes intercourse more pleasurable, and there's less damage to the mucous membrane inside the vaginal canal when there's moisture. And all of that depends on hormone levels. Women with low libido, which libido is sex drive, women that have a low libido, that can be traced to low hormone levels as well as psychological factors. Maybe there was sexual abuse in the history, or certain fears or concerned about sexuality that would inhibit a woman from orgasm. Of course, orgasm in the female is not necessary for fertilization to occur, only in the male. So the process of orgasm in the female is not necessary for reproduction. So if we look at fertility of the female, the egg is only viable for 24 maximum 36 hours after ovulation. So once that ovary releases the egg, that egg is available to be fertilized for 24 hours. After that, it starts to break down and is no longer viable, no longer able to be fertilized. However, sperm can live in the female reproductive tract for up to 6 days. So that leaves a lot of time, a greater window for pregnancy to occur if intercourse happens before ovulation. So for couples that are planning pregnancy and trying to improve their fertility, planning intercourse prior to and just after ovulation are ideal times of the month to plan intercourse. Sometimes, however, that fertilized egg does not implant in the uterus. Sometimes it remains in the fallopian tube, and that results in what we call an ectopic pregnancy. Ectopic just means outside of the normal location. So any pregnancy that is not implanting in the uterus would be called an ectopic pregnancy. And ectopic pregnancies that occur in the fallopian tube can be life-threatening to the female because of the bleeding that occurs. And oftentimes they will lose that fallopian tube on that side when they go in to have that pregnancy, terminated and removed, because a baby cannot develop in a fallopian tube. There simply isn't enough room and doesn't have the necessary materials to support a growing fetus. But the good news is the eggs produce, the ovaries produce an egg every month, and they switch from side to side. So one month it might be the left, the next month it might be the right ovary producing the egg. So if a woman loses an ovary or loses a fallopian tube, the other ovary or fallopian tube can accomplish the job. So the breast of the female, under the influence of female hormones, develop and produce milk and the milk production occurs as a result of changes in hormone levels after childbirth. And the alveolar glands we talked about in lab develop and produce milk and send that milk through the lactiferous ducts out the nipple to nourish the newborn. So we see the darkened region around the nipple that has oil glands that help to nourish the skin around the nipple to prevent breakdown as the newborn suckles. And it also serves as a visual target for the newborn to find the food source, to locate the nipple. So there's ligaments, just as in the scrotal sac we talked about in part 1 of our lecture. The scrotal sac is supported by ligaments, and over time, with age, those ligaments become less taut, and the scrotal sac sags a little bit lower with age. And the same thing occurs with females, because of the ligaments that support the breast are aging and are not as tight as they used to be, and that causes a sagging of the breast as well. So the top of the breast here becomes less, there's less fatty tissue, and with the ligaments lengthening and stretching over time and age, the breasts lie flatter against the body. And you may have heard, if you've taken a CNA class, talking about using the gait belt to help elderly women ambulate or transfer from chair to bed, to be careful to not wrap the gait belt around the breasts. And that may seem odd that would be a concern, but with the changes that happen as we age, the female breast can be down around the waist, and definitely interfere with putting that gait belt on. So it's always important to be sure that you know where the patient or the resident's breasts are before you put a gait belt on, because often elderly women do not wear a bra. So here we can see sperm movement up the female reproductive tract. So it's quite a process. These sperm have to travel quite a distance, and millions of sperm are ejaculated into the female reproductive tract. Only one sperm will enter the egg, because of the acrosome on the surface of that sperm head creates a chemical reaction with the outer cells of the egg to allow only one sperm to penetrate. So that process of fertilization occurs in the uterine tube, and then it takes a couple days for that fertilized egg to make its way down, and in the same time that fertilized egg is dividing into more and more cells until it eventually implants in the uterine wall, and then it develops. So fertilization takes place in the uterine tube. Implantation of that fertilized egg takes place in the uterus. So during pregnancy, we see some hormone changes. The number one hormone that is of interest in pregnancy to determine if a woman is indeed pregnant is HCG. It stands for human chorionic gonadotropin, and that is released by the placenta, the early cells that will form the placenta, as it implants, after it implants in the uterus. So it takes time for that HCG to rise in the blood and to end up in the urine as the blood is filtered by the kidney. So oftentimes women can be indeed pregnant but have a false negative on a pregnancy test because the HCG levels have not risen to a high enough level to be detected by that test. And it's interesting, I taught a health class years ago and we analyzed different pregnancy tests and the HCG levels that were present that they could detect. And it was interesting to find that the dollar store pregnancy tests actually had the most sensitive tests compared to some of the more expensive name brand pregnancy tests that were not as sensitive and required higher levels of HCG to be present in order to achieve a positive result on the test. So it's important to make sure that the test a woman uses is a sensitive test, and that if a woman gets a negative but she thinks that pregnancy is possible or may have occurred, that she test again. Of course, if the menstrual period comes, then that's an indicator of that a woman is not pregnant. But if a woman finds that she misses her menstrual period, she might want to retest with a good sensitive pregnancy test to see if she's indeed pregnant. So we can see these hormones, that's early in the first 3 months of pregnancy, and then we can see the other two hormones, progesterone and estrogen, steadily increase toward the end of pregnancy. And what estrogen does, these two hormones actually are released by the placenta. They're not secreted by the ovaries. These are important pregnancy hormones, but they're actually released by the placenta that's developing with the fetus. But we can see that estrogen levels increase toward the end of pregnancy. And estrogen actually acts to irritate the uterus, and that's why women at the end of pregnancy find that they have more Braxton Hicks contractions because of rising estrogen levels. And that also is figured to be one of the stimuli of inducing labor and delivery, is rising estrogen levels. So this slide just has a couple of kind of categories of birth control that we see out there. There's new methods being developed all the time, especially the long-term methods like the Depo-Provera shot that require less daily or weekly maintenance of taking a pill or applying a patch. So each of these has its own risk factors and benefits, so it's important to talk to your doctor and understand what the risks and the benefits are of each type. Of course, vasectomy and tubal ligation are the most effective forms of birth control. So for couples that are not interested in having any more children, those are the preferred methods because it doesn't involve any hormones and it's permanent, and in most cases, I should say it's permanent. Sometimes people will have a tubal ligation reversed or a vasectomy reversed, but most cases they are permanent, permanent choices for birth control. So as we age, what do we get to look forward to? We have in males a decrease in the size and weight of the testes. That's due to declining testosterone levels. Decrease in sperm production, again as a result of decreasing testosterone. And the prostate gland enlarges, and we see an increased rate of prostate cancer. And because of that enlarged prostate gland, remember the prostate surrounds the urethra, that can cause difficulty with urination in men as they age. So even if they don't have prostate cancer, an enlarged prostate gland is going to impair urination in some men and results in them having to self-catheterize in order to urinate. Impotence, which means the inability to have or maintain an erection, is a problem with aging, and it's a result of a number of factors. Sometimes it can be a blood pressure medication. It can be a result of diabetes, a result of neurological conditions like Parkinson's or multiple sclerosis, a whole host of reasons for that. And decrease in sexual activity. Again, declining testosterone levels affects the libido, and there's less interest in intercourse as men age. But of course, that doesn't mean that men are not sexually active well into their 60s and 70s, because that still is definitely true. And we have to remember our elderly patients and elderly residents do have needs for physical touch, and we have to respect that in couples that might be in a nursing home together, for example, that they do have physical needs, and just like they did when they were younger, but maybe not quite as intense due to declining hormone levels and atrophied reproductive organs. Females, the ovaries become non-functional, and that results in menopause, stoppage of the menstrual cycle. And because of declining estrogen, that causes a decrease in the size of the uterus and causes a thinning of the vaginal walls. It also causes a dryness of lack of secretion or limited secretions within the vaginal canal. So intercourse for older women becomes a little bit more difficult. So using lubricant is a popular alternative. And it's especially upsetting when you hear stories of elderly women that were raped in their apartment while their apartment was burglarized, because that causes significant trauma to the reproductive organs because of vaginal dryness and thinning vaginal walls and atrophied vaginal canal. So it's important for any woman of any age, if she has been forcibly penetrated or raped, that she go to the ER and get a physical exam to have that documented, because they will look for signs of penetration that was forced, and that does cause trauma to the female anatomy, and it's important to get that documented as soon as possible. So if you know of anybody who was forcibly raped, that they be seen and go to the ER to be checked out. Also, we see age-related increases in breast, uterine, and ovarian cancers. Breast cancer, we know, is a very common cancer among women, and again, sometimes that can be related to high estrogen levels. We know that there's certain chemicals in our environment that have been linked to increased risk of breast cancer, one of those being the chemical in plastic bottles. So we're trying to get away from plastic bottles or storing water in plastic bottles that we freeze or expose to high temperatures, for example in our cars, because that leaches out the chemicals in the plastic bottle into the water, and that has been linked to breast cancer. Uterine cancer is another cancer that we see in women that have had children. And ovarian cancer is a deadly form of cancer because it does not have symptoms until it's in the later stages. But with advances in chemotherapy and advances in detection, we've come a long way in the treatment of all of those cancers. So it's always there's always hope for people that have been diagnosed with those cancers with good medical treatment. That concludes our discussion of the reproductive system. I recommend that you get onto Blackboard and look at a participation worksheet that I have put on the reproductive system. And if we look at this first page here, I'd like you to identify the structures in the diagram. So write the name of the structure and then write a brief sentence about what its function is in terms of how it promotes reproduction. And then on this page, we're asking you to identify what happens on day 1 of the menstrual cycle and what happens on day 14. And I did talk about that in our lectures, so you should be able to answer those questions. And then for these 3, just indicate some brief functions. And I can tell you those right here. What I'm looking for is LH triggers ovulation. Progesterone affects the uterus and thins the cervical mucus, so that promotes fertility. And estrogen contributes to secondary sex characteristics, which means breast enlargement, fat deposition around the hips, all those female sex characteristics, as well as we talked about bone growth and decreasing HDL or increasing HDL levels, leading to lower cholesterol. So be sure that you have looked at this and you've studied these parts, because that'll help you prepare for the lecture exam on the reproductive system.